So everyone ready? All right, so I'm gonna start. It's me again. Hey, I'm back for round two. This time we'll talk a little about virtual reality. How many of you guys are familiar with virtual reality? Do you guys enjoy virtual reality? Yeah. I'm looking at you, Charles. All right, so it's my senior lecture. Again, kind of like Charles. I didn't really know what to talk about. A lot of topics go through my head. So just pick one that's interesting to me, and hope it's interesting to all you guys as well. So just quickly summarize. I'm going to start with talking about what is virtual reality, or what is VR. Then after that, I'm going to move on to talking about a little bit about evolution of VR. After that, we'll talk about a little bit about VR in healthcare as well as medical simulations, kind of what I'm into a little bit. And I'll end my talk with talking a little bit about what the future holds for VR. So VR, virtual reality, by the Oxford definition, is the computer-generated simulation of a three-dimensional image or environment that can be interacted with in a seemingly real or physical way by a person using special electronic equipment such as a helmet with a screen inside or a glove filled with sensors. So in short, it's artificial environment that's created with software, computer. It's to be such to the user that can suspend belief that they're actually in a real environment. So a lot of times, virtual reality and augmented reality are kind of used interchangeably and can be a little confusing, but they're actually two very different terms. Virtual reality, kind of like the previous slide talked about in definition, it's a complete immersive experience where shuts out the entire real world, and the user can interact with elements, the virtual elements inside a virtual world. Versus in augmented reality, kind of like in Pokemon Go, you have digital overlay of digital elements, but the users are still in the real world and they cannot interact with actual digital elements that's inside the world. Today we'll focus a little more on virtual reality. Formatting got a little screwed up over here. So let's start with the timeline. So what started all of this? It's set around 1838 when they first came up with this thing called a stereoscope. It's by a gentleman named Charles Whitstone. Essentially, he created two pictures side by side, as well as funky-looking glasses called a stereoscope, where once you put your face in the stereoscope and look at the two pictures, it gives you the sense of depth as well as immersion. So all you can do is just look at different pictures, and that's to the extent of it. It's not until 1957 when this filmmaker named Morton Hillig created this thing called a sensorama, and that was the first real immersive experience. It's complete with smell, surround sound, it has vibrations, and this one even had atmospheric factors such as wind, air, as well as all the natural things you can feel inside the real world. It was a real 3D immersion experience, but it's really for short clips. In 1968, Ivan Sullivan came up with this thing called a Sword of Damocles. It's this huge thing that hangs down from the ceiling. That's because it's so heavy, it needs support. But it's also the first device that generated pictures from a computer. The computer display will create these virtual shapes that you can see using the huge glasses that the guy is wearing, and it will change perspective based on how the head moves. In 1975, a gentleman called Thomas Furness created this virtual cockpit called a super cockpit. Essentially, these are virtual cockpits used to train pilot trainees. The computer will create a 3D maps, radar technology, as well as avionic data for the trainee to simulate actual flight. Moving on a little bit, closer to the current timeline. In 1989, NASA started applying some of these technology. They came up with this thing called VIEW, or Virtual Interface Environment Workstation. It's used to train astronauts, especially train them in a zero gravity situation. So they have these goggles, as well as gloves, and they'll do these exercises, essentially putting them in a zero gravity situation where they can do the simple tasks and fine tasks that's needed in the space stations. In 1993, the gaming industry started moving toward more applying more of this technology as well. Sega is the first gaming company that applied the technology. They created this thing called a Sega headset for the gaming system called Genesis. This headset included a head tracking, stereo sound, as well as LCD screen in the visors. However, it never went into full production because at the time the cost is still very, very high. It's not really until 2010 when the virtual reality technology became a lot more mainstream was the Oculus, created by Palmer Luckey. It's a 90-degree view, and it was the first consumer product. At the time, you can just connect the Oculus to any computer or any gaming consoles that can support a virtual reality software. Connect to the headset, connect to the handsets, and you can enjoy your experience. But in 2020, today, over the course of the last 10 years, a lot more has even happened. Now these headsets are standalone. You no longer need a computer. You no longer need any type of gaming consoles. And you can just carry them everywhere. They're portable. And most importantly, they're much cheaper and much more affordable. This allows for much widespread usage and applications. And you'll see a lot more of that is going to be going into the healthcare field as well. So I'm going to switch gear and talk about how exactly virtual reality is used in healthcare. But we'll start with some videos, some representative videos. We'll start with this one. So this is probably not what we're looking to do when we're training in VR. Although it's a lot of fun, at the same time, we probably don't get to play with aliens that much. So let me see you a more realistic one. This is fun. I want to try this game. Fast forward a little bit.
And AI solve. We've designed these experiences to simulate training in low-frequency, high-acuity events. These are situations that don't happen often, but when they do, the stakes are high and lives are on the line. As we begin Module 1, the resident is placed at the foot of the bed. Our emergency medicine technician provides a debrief and current patient status. Our user is presented with a lifelike patient in need of immediate medical treatment. Team members include our ER nurse, respiratory therapist, and pharmacist. Interactive elements include the IV card, airway card, and selectable medications from the code card. Navigation and selection protocols allow the user to make real-time decisions for patient treatment. The resident can also interact with the patient through hotspots on the body that allow for haptic pulse check, capillary refill, breath, pupil, and cardiac checks. VR training experiences like these provide our residents with an immersive and engaging way to learn new skills and become more confident and better prepared doctors. We believe this is the future of medical skills training and will have a major impact in medical education.
So that's more of what I think is appropriate use of VR in medical education. Obviously, that guy is probably a IM resident or PEDS resident, but that's beside the point. He didn't really know what he was doing. So VR, obviously, I think it's very useful in emergency medicine, but it's really used in many different fields of medicine as well. So, for example, in the pharmaceutical industry, I guess it's a little bit off branch. A lot of production require a lot of precision as well as a lot of control. They use a lot of complex equipments that it's not easy to learn. So a lot of these engineers actually learn how to use these equipments through training via VR. In terms of rehab medicine, actually, the virtual environments a lot of times are set up for patients to get them to get better. They're created because a lot of these environments are difficult to create, just in the physical world, in the clinics, as well as in the facilities. One example is one application called a Mind Maze. It's actually purely designed for stroke patients. The application itself helps the patient recover by mapping a lot of patients' movements onto a 3D avatars and customized interactive exercises that are based on standardized neural rehabilitation principles. Of course, in surgery, you can imagine surgeons practice either open or laparoscopic surgeries can use VR simulations, and more importantly, these exercises allow them to respond to complications, both common and rare, appropriately. And lastly, in EM, the most common reason why we can use virtual reality is for procedures, but we can also use it for skills for team resuscitation, communication. We can also use it to teach wilderness medicine because we're not really out there all the time, and as well as disaster preparedness. Let me just show you one more video of how we can learn about intubation using VR.
Just because of because this is straight. Because again, this is an adaptation. And that can be part of the Nice work. To your left is the menu tab.
So as you can see in this video, a lot of people who practicing use this aren't even experienced people like us. They didn't get any formal education. At the same time, you're able to learn a lot of skills without actually ever having to touch any of the physical equipments. Don't get me wrong; it's still good to know how to know each thing's feels, like the tubes, the ambu back. But in a resource limited environment, you can just start with a VR. So let me back to the presentation. So now we've kind of talked about how VR can be applied in different fields of medicine. Let's focus a little more on how it can work in emergency medicine specifically. So some of the new and interesting applications that I came about, including, like I kind of talked about earlier, disaster preparation, CPR training, residency applicant interview process, as well as analyzing ED crowding issues. So disasters. We're all ER physicians. We are kind of adrenaline junkies. We want to be able to go into disasters and be ready to do what we need to do. However, a lot of these disasters are rare and we might not be encountering all the time, which is a good thing, probably. So there have been some more researches done into how we can learn, be more prepared about for disasters using VR. A group of Chinese physicians actually started first by looking into how they can use VR in disaster medicine. And the study showed that By using VR, the immersive and interactive characteristics of VR can really greatly enhance students' ability to perceive and understand these real disasters. At the same time, the VR technology allow the students and teachers to understand the abstract problems much more and have them become much more concrete than just an idea. And more recently, after the Ebola outbreak, a group of Italian physicians actually created this virtual reality model to really help everyone become more prepared for Ebola. Their VR model included first is an aerial view of the Ebola treatment center, where a simulation master is able to explain the layout of the site Ebola center to all the trainees. At the same time, the model also include a first-person perspective where the trainees can walk through the entire Ebola training facility, treatment center, as well as learning about the intricacy of the actual center. While walking through the training center, the trainee can learn about basics such as donning the PPEs, cleaning body fluids, as well as executing accidental exposure protocols. And lastly, a group of physicians created a VR model for really how to deal with MCIs, especially given their more recent increase in numbers of mass casualty events, especially due to gun violence in the United States. More and more resources have been dedicated to that. This group of physicians similarly created a hospital, online virtual hospital, following establishment of multiple number of virtual casualties. And they had multiple clinicians actually simultaneously work on this virtual world, responding to the event, treating all these virtual casualties, responding to them appropriately with the amount of resource the hospital have, and plan for transfers appropriately as well. The errors, the delays, and all actions for these physicians were recorded and subsequently analyzed with the physicians to see if they did the appropriate things. Moving on. So while disaster preparedness VR models are often very successful due to their intricacies and details, simple VR models for CPRs training has also proved to be very useful. So one study looking into how CPR training using VR models versus mannequins. Actually, this study used medical students as subjects and motion sensors were placed on these students during their training. And the results show that VR training is equally as good as mannequin in terms of compression depth and compression rate. While all these students actually appreciated VR environment more and determined that the experience is much more memorable and they learned the material much better. Actually, I think Dr. Kim already is in the process of introducing some VR headsets for CPR training, maybe first for anesthesia residents, but eventually I think you guys get to play with that as well. So another group looking to VR training using existing CPR, so mostly for bystanders. So they used a conventional mobile app for what do conventional bystanders should do when there's cardiac arrest versus a VR version of the mobile app. And they enrolled 105 bystanders, and the result shows that in the VR group, a lot more people called 911 and activated AED much earlier, while the quality of CPR is the same in both groups. So one of the new and more interesting applications of VR is how it's used in the interview process. Pretty sure all of you guys know the interview process is growing, it's repetitive. Pretty much a lot of time you kind of just sit and talk over and over again. So what this residency in Texas did is that they incorporate an VR exercise into their interview process, where part of the interview day they ask all interviewees to participate in VR simulated medical cases. The interviewers themselves were able to observe the applicants and see how they communicate, check out their subtle personality traits, as well as see how the general teamwork abilities of the applicants do a VR exercise. The interviewer said that they were able to pick up a lot more insight beyond what just the paperwork of the applications presented to them. Interviewees also all appreciate the exercise, and they felt that the VR edition was a valid alternative for them to demonstrate their characteristics and abilities. And one last thing that I looked into is how VR can be used in research for ED crowding. A lot of research has been done on what we think causes ED crowding and what are some of the solutions for ED crowding, but not too much has been done on how ED crowding affects physicians as well as the quality of care they provide when they are faced with overcrowded ED. So one group of physicians developed a virtual environment, a virtual hospital, or virtual ED in this case, to evaluate the effect of physician strategies as well behaviors on the quality of care in an overcrowded ED. Of the 13 participating physicians, they all deemed the VR environment to be authentic and replicable and consistent. And after each exercise, the participants were able to review his or her decision-making abilities and how those decisions affected quality of care for the patients in the overcrowded ED. Now that we explored some of the current existing applications of VR in the medical and medical education as well as simulation, let's talk a little about the future of VR. So one of the future I think for VR is this journal, Journal of Medical Internet Research, or JMIR. Basically, it's a group of peer-reviewed, open-access medical journals that's really covering health in the internet age. One of the JMIR members, the JMIR Serious Games, is actually a multidisciplinary journal devoted to studies applying elements of gaming to fields of education as well as healthcare. Currently, it's a forerunner of publications for VR research, and I foresee that as VR research expands, this journal will be the primary source of studies for advancement in VR now as well in the future. So one element of VR that still currently has not been fully utilized is social VR. Essentially what social VR does is that it gives users the ability to meet other people and talk to them in a virtual world. Users can interact with other users through either a developer-created world or a user-created world. An example of this, how many guys seen the movie Real Player One? Right, so the main character is essentially in a huge virtual world playing games with millions of people, and in the meantime he's just reading his trailer sitting with headsets on. So this is what social VR should be. It's essentially you can just sit where you are, put on a headset, and communicate and do whatever you need to do with everyone else who is the same program. So social VR, for example, will allow meetings to occur remotely, where you can interact almost directly with people you're meeting with. And from a simulation perspective, you can have simulation cases where not everybody has been in the same room. This will work specifically for these multidisciplinary simulations where you involve people from different areas where it's really hard to get them together to be at the same room, same time. So everybody can just go to where they need to go, put on a headset, and have the simulation case together. Lastly, let's talk about a technology that's already upon us. Even though it's not as well spread, but it's here already. And that is mixed reality. Can anyone think what mixed reality is? What do you think it is? Mixed reality.
Where it takes elements of the room around you and adds virtual pieces to it?
Essentially. So mixed reality is really a combination of VR as well as augmented reality. It allows real and virtual elements to interact with one another and the user to interact with virtual elements but in the real world. So instead of a fully immersive environment like VR, mixed reality joins the virtual and the real world into one connected experience. So for example, a surgeon is doing surgery. The surgeon can wear a headset And what the headset allow them to do, or glasses allow them to do, is they can pick up the CT images of the patient, overlay it onto the patient while they're doing active surgery, and they can manipulate the CT images however they want. And hopefully that can assist them in doing the surgeries. And for simulation purposes, we can imagine us overlaying a mannequin with all the details of anatomy onto a real mannequin. So when we're practicing any kind of procedures, we can also visualize the anatomy that's underneath as well. Ultimately, the device in the future should have the capability of switching between virtual reality, mixed reality, as well as augmented reality, whichever you need to really fit your need. And here's just a video on what mixed reality is. It's here, it's just not everywhere yet.
To HoloLens 2. Now,
as I put on my device. Now, not only does the HoloLens 2
You get closer.
Sorry, I don't have premium.
It still works. Still works. Still works. Yeah, I don't need a new one.
to recognize me, it also recognizes my hands. Look at this. Fully articulated hand tracking. And as I move my hands around, the HoloLens 2 is actually calibrating to my unique hand size. And of course, not only does the HoloLens 2 recognize me and my hands, it also recognizes the world. Welcome to my mixed reality home. This is the place where I have all the apps and content that I use every day. Let's check some of them out. Now, I've seen many people put on HoloLens for the first time, and the first thing people do when they put on the device is they reach out their hands and try and touch the holograms. And now, you can. Look at the way that the hologram is responding to my hand, almost inviting me to touch it. And in fact, I can just grab this corner to resize it. Or I can rotate it. Or move it. That's right. We are touching holograms. This is an app I've got called Spatial. Let me just put it right there. I've got another app here called Euphoria View. Now, it's a little big, so let me just use 2 hands here to make it smaller, and then rotate it so you can see. There we go. And then let me put it down here near Spatial, maybe make it a bit smaller. Yeah, that's nice. All right, now let's switch gears and talk about a different kind of application. I've got a browser over there, but it's kind of far away, and I don't really want to walk over there, so let me just call it over with my voice. Follow me. This is a browser that's running Microsoft Teams, which is a tool that we use back home to collaborate. Let me see what the team's been working on. Okay, it looks like they've got a surprise for me in the Playground app. I just have to say the words show surprise. All right, so let me just open up that start menu here, and then place the app, and then launch it. So now we're actually exiting my mixed reality home and going into an immersive experience. But notice that that browser that I had actually followed me in. Now this can actually be really useful when you have things like emails or PDFs that you need to reference while you're doing your work. I don't really want it following me around though while I'm showing you all this cool stuff, so let me just put it over here, and then we'll get back to it later. Welcome to the playground. We spent years exploring and refining interactions for HoloLens 2, and the playground is just a tiny sampling of the many prototypes that we built, tested, and learned from. Our approach was basically to try out as many things as we could and look for the things that stood out. So, for example, here I've got 3 sliders. Each of them is controlling this wind farm simulation, but each in a different way, using a different interaction technique. One of the things we tried is this touch slider here. So here I can just stick my finger in the slider and have it go to a particular value to control that wind speed there. It felt okay. We also tried this push slider. So this guy can kind of nudge from side to side, kind of like an abacus, which was interesting. Now, the interaction that really took home the cake, though, was this pinch slider. The way that works is you just pinch it and move it wherever you want. And what we found was that people really like that tactile sensation of their fingers touching as they grabbed and then released. And across the board, for all interactions, the audio and visual feedback as you grab, move, and then release were all really critical for making this experience feel connected. Oh, this is just so satisfying. I can't wait for you all to try this out. All right, now let's move on to a different kind of control, buttons. How do you press buttons on HoloLens 2? Well, you just reach out and press them. Now, one interesting thing that we found about buttons was that the size of the buttons actually impacted the way that people interacted with them. So, for example, for the smaller one, most people would use 1 or maybe 2 fingers, but for the larger one, pretty much everyone used their entire hand. And this is kind of interesting when you think about it, because these objects don't really weigh anything, they're just digital things, but despite that, people would treat them like real things, almost as if the bigger one had more weight. I just love the way these move and the sounds they play when I press them. It's great. All right, how about something that uses all 10 fingers? Well, to test that out, we built a piano. So here I can just play a chord.
Just fast forward a little more.
Or I can play the keys one at a time.
Hey guys, let's come up with some ideas for a line of aquatic toys.
Yeah. How
I remember loving football from day one. I wrote this a long time ago. I don't know how old I was. I hope.
about sea turtles?
Oh, that's really cool. Let's try sharks.
That's cool. How about jellyfish?
So all we have to do is say the words and they're instantly visualized right before our eyes. You can even click into one of these bundles and they expand it to a full-blown internet search, complete with 3D models, images, and web pages. Jenna, why don't we click into just the images here so we can get some good inspiration for this new aquatic line?
Sure. Every object you see in spatial is physical and tactile, so you can scroll through or pick up images you like and toss them up on the wall with physics.
And we don't have to just stick with digital content. I can actually pull up these sketches I did on my phone last night using that same spatial app. I just pull up those photos and hit send, and they're instantly transformed into this digital environment.
Nice drawings. It's so easy to fill up your room with ideas, so we built this tool to help you quickly organize all these ideas. So let me select all of these.
The guy is virtually conferencing.
Let's make
This
it
is the
clear.
avatar.
This goes to the wall.
Now, this entire room we've created is a persistent digital object that anyone can access or contribute to at any time, whether they're using an AR or VR headset or even a PC or mobile phone.
So that's right. Now we can have virtually rich visual rooms that we can keep up for the life of the product. That means no more tearing down war rooms all the time. So Spatial and HoloLens are helping us drive improvements in our digital design and development process, changing the way we create new toys. By bringing people together from all over the world to collaborate in the same virtual room, we're overcoming a natural barrier to our collective success. That's people's desire for direct face
individual participation. But now, let's make it more collaborative.
Sorry.
Wish you didn't have to pay full price for Nintendo gear? Wikibuy can help with that. It automatically compares Amazon's...
Let's see.
By leveraging the Azure Spatial Anchor service within Vuforia Studio and Veo, we can let Maria seamlessly join in Alex's experience. Maria can simply take out her iPad and launch Vuforia View. Once Maria points her iPad at the same location where Alex placed the blower, she can participate in the mixed reality experience, making it far more interactive and collaborative.
That's right, Jim. Now that Alex and I can share the same experience, I can create a number of different training scenarios. Alex, let's simulate a gear failure mode.
Uh-oh, I see their gear vibration went down, and I have here threshold exceeded. Please inspect. Let's go ahead and select that.
Alex, I think you might be dealing with a broken gear tooth. And you will probably have to replace the gear assembly.
All right, I'll roll up my sleeves and get some work done here. Let's do it. I'm ready.
Right, I'm gonna start the disassembly instructions for the gear assembly.
There it is. I see it.
Now that Alex is using HoloLens 2, he has access to a wide range of hand and eye tracking capabilities that are all available in Vuforia Studio.
So yeah, so those are just some applications of mixed reality. And as you can imagine, all these different parts can really apply to medical education, medical simulation, especially the last part where an instructor can really go through a case with somebody just using an iPad while the other person is wearing the goggles. So not everybody needs a goggle for the actual training. So that about sums it up. Again, virtual reality right now is everywhere. These headsets are affordable. They can be easily purchased, and the application for them is really, really enormous and everywhere. They're very useful. Some of the things we saw in the medical fields. But ultimately, get excited for mixed reality because I think that is going to be the new future. Just kind of like all those futuristic movies. It's just me, a picture of me and Tess at ASAP. We're working really, really hard to try to solve a case. The patient was at the bottom of Everest with Everest Base Camp. The patient had altitude sickness. And actually, the patient ended up having high altitude pulmonary edema. And me and Tess had to figure out how to get the patient into a portable hyperbaric chamber. And the most difficult part was actually finding a chamber in the room because it's mostly it's a little book bag. You just gotta inflate it. I never worked with one in real life before, so I thought that was really interesting because I don't think we will really get exposed to that kind of training. Yeah. So before I end, again, I'd like to thank my class as well. We have grown a lot from interns on top to fourth years on the bottom. I also like to thank my sim family. I'm pretty proud that 4 of us can go to sim next year. I think no other class have ever done that before. And again, I also like to thank all the faculty members who really helped me grow the last 4 years, and I'll always remember that. So with that, any questions? Anyway, this gym is plugged to my dog. Please follow him on Instagram at Waffle Defensive Dog. But any questions? Everybody has babies. Not everybody has a dog like that. Any questions? All right. Here are my references.